welcome back to my channel. This is actually a quick recap of the anatomy topics, especially in embryology, and this session is on development of central nervous system. For detailed version, please do watch my channel. This is just a quick recap, so I won't be going into the details. So let's begin. We know that the central nervous system is mainly ectodermal in origin. That is the part of the ectoderm which is getting redefined as the neuroectoderm. That will be giving rise to the neural plate, and the major inducers for this transformation are the notochord and the precaudal mesoderm. And after that we have the neurulation process, whereby the neural plate will form the neural folds, the neural groove, and then finally the neural tube. And you can get in the beginning you have the anterior neuropore and posterior neuropore, which later fuses to form the entire neural tube. Even in the anatomy quick review series, I have mentioned about the formation of neural tube, the neurulation process. Please see that also. We can see as the neural tube is formed, as the neuroectoderm is getting separated from the surface, you can see a group of cells which are lying on either side of the neural tube. They are the neural crest cells, and a portion of it, a dorsal portion, forms the melanocytes and skin and hair follicles, whereas the ventral portion will form the sensory ganglia, sympathetic and enteric neurons, Schwann cells, and cells of the adrenal medulla. Again, a detailed version of the neural crest cells are also mentioned in that series. So all are derivatives of neural crest cells except sensory ganglia, sympathetic ganglia, melanocytes, adrenal cortex. The answer is adrenal cortex. Then as the neural tube is formed, we can see three dilatations, three brain vesicles. They are the forebrain, midbrain and hindbrain vesicles. Now the forebrain vesicle is known as prosencephalon, the midbrain vesicle is known as mesencephalon, and the hindbrain vesicle is known as rhombencephalon. The forebrain vesicle, the prosencephalon, which will later form the telencephalon and diencephalon. The mesencephalon is just remaining as that, and the rhombencephalon will again divide into metencephalon and the myelencephalon. This is very important, because then you can easily mention about the derivatives of the central nervous system. So telencephalon gives rise to the cerebrum, diencephalon gives rise to the thalamus, hypothalamus, metathalamus, epithalamus. Mesencephalon is giving rise to only the midbrain, metencephalon to pons and cerebellum, and myelencephalon to the medulla and spinal cord. So once again you have the telencephalon, diencephalon, mesencephalon, metencephalon and myelencephalon. Telencephalon forms the right and left cerebral hemispheres. Diencephalon forms the thalamus, hypothalamus, metathalamus, epithalamus and subthalamus. Mesencephalon forms the midbrain. Metencephalon forms the pons and cerebellum, and myelencephalon finally forms the medulla and spinal cord. The remaining part of the neural tube, along with the remaining part of the neural tube, forms the spinal cord. Now, aqueduct of Sylvius is the cavity enclosed in which part? We know that it is the cavity seen in midbrain, that is the mesencephalon. So let's see what are the cavities enclosed within the brain vesicles. Telencephalic vesicle encloses the lateral ventricles. Diencephalon encloses the third ventricle, and the lateral ventricle is communicating with the third ventricle through interventricular foramen of Monro. Then you have the mesencephalon, in which you have the aqueduct of Sylvius, which is actually connecting the third and fourth ventricles, and the fourth ventricle is actually spread over the rhombencephalon, and the central canal is seen in the spinal cord. When we mention about the development of the hypophysis cerebri or the pituitary gland, again I have done a detailed version, please do watch. There are mainly two sources. One is known as the Rathke's pouch. This is actually an ectodermal outpouching of the stomodium. And you have the infundibulum from the diencephalon. The Rathke's pouch detaches, actually this gets detached from the oral cavity, and this fuses with the diencephalon roughly about 8th week. So the Rathke's pouch, which are the derivatives? The anterior wall of the Rathke's pouch forms the anterior lobe, the adenohypophysis. Posterior wall forms the pars intermedia, and pars tubalis is actually the extension of the anterior lobe along the stalk of the infundibulum. Now the infundibulum actually forms the stalk and pars nervosa or the posterior lobe, the neurohypophysis. And have you heard about a clinical condition known as craniopharyngioma? If the Rathke's pouch remains without getting degenerated, the remnant of the Rathke's pouch is known as Craniopharyngioma, and the patient usually presents with hydrocephalus and pituitary dysfunction. Cerebellum is derived from metencephalon. Identify the clinical condition. You can see that the eyes are not developed, the nasal region is not developed. So this condition is known as holoprosencephaly. So the mutation is on the SHH gene, and you can see when you look at the midline, there is loss of midline structures, and there will be only single telencephalic vesicle, and as a result what happens, the two lateral ventricles will be fused as one. The eyes will be fused, there will be single nasal chamber, and there will be single central incisor. These are the features of the holoprosencephaly. Identify the clinical condition. You can see a defect in this region, and that condition is known as Spina Bifida. I have done a detailed version of this as well. So these are the different patterns of Spina Bifida. This is Spina Bifida occulta, where you can just see a dimple and a tuft of hair follicle, hair. Then meningocele, where you get the meninges protruding through the vertebral defect. Meningomyelocele means along with the meninges, the spinal cord also protrudes out. Rachis means the entire neural tube will be exposed to the outside. So this is the neural tissue which is exposed, and this is actually the folded neural tissue which is exposed. So both are rachis. Identify the clinical condition. You can see a protrusion from the cephalic region. So what do you call that? That is meningoencephalocele. If the brain is getting protruded out, that is encephalocele, meningoencephalocele. So identify the clinical condition. You can see the extent of the lesion, and this condition is known as craniorachitis, where the entire neural tissue is exposed. Craniorachitis is extensively failure of fusion of the neural tube cranially and caudally. There will be anencephaly along with spinal cord defects. What is this condition? You cannot see the vault, and there is absence of the brain tissue. So this condition is known as anencephaly. So what do you mean by schizencephaly? Here the cerebral hemispheres have large cleft, and brain tissue will be absent. Microcephaly means a small cranial vault. There will be defective brain development, and usually the causes attributed are toxoplasmosis, radiation, and teratogens. You should also know this condition, that is Arnold-Chiari malformation. Here the cerebellum will be herniating into the foramen magnum. As a result, there will be hydrocephalus, that is obstruction of flow to the CSF, and there will be associated abnormal development of the spinal cord as well. So that's about the development of central nervous system in a nutshell. For detailed versions, please do watch my channel. Please leave your comments. Thank you for watching.